Now this video here, I know it's a little bit grainy, but it's recorded way back in 2007. I know the person in the video, and if you look at it, you can see the FUE. It's a very small punch. It's been very well spread, the extractions all the way throughout the donor, and we've kept to an extraction pattern. So number one of this video, when we look at FUE, would really be the area where you take from, and a lot of clinics will be taken just from, sadly, just from the occipital. This area is very rich. You expect high density, the angles are a little bit easier, but a lot of FUE will concentrate just on this area here. And the detriment to that is really the lack of longevity that you give to the patient, because once you take here, inevitably you over harvest, you can't really respect an extraction pattern, so you can obliterate and really damage the richest area of the donor. For a hairline for a patient, yep, it can be thick because you've got loads of 2, 3s and 4s in this area here, but the detriment is really that you're going to obliterate a very rich area that should then be in the bank for more loss. So with Dr. Bisanga, we won't limit ourselves by just taking from the occipital. Number one will be really the area of extraction, and we will make sure that we spread as much as we can. For the finer hair grafts, Dr. Bisanga will take around the ears and also in the nape area, but we will spread our extraction and make sure that we don't just go for the occipital only. So number one, look at the area where your doctor will be taking your grafts from. You really do need to cherry pick. One strength of FUE is the fact that you can cherry pick. So you can go forward and get the finer grafts. You don't need to concentrate it on the rear. So number one, the area where your clinic will take your grafts from. Number two would really be the patterning. And again, what you need to have in FUE is you have this patterning whereby, and we've spoken on extraction patterns. I've personally been writing on it since around 2010, so a good 12 years, and prior to me as well at BHR, on extraction pattern, trying to make it an industry term that is mainstream now, that when it comes to FUE, it's not about taking every single follicular unit, but taking and jumping, and making sure that you give this pattern so that once the skin is healed, and doing this, you give actually a better chance of healing. You don't have any over harvesting, any moth-eating effect. So number one will be the area. Number two, make sure the pattern is good. You've got none of these holes that are joined together to give you any larger issues. So here you can see again the pattern very well spread, very small punch, and this will give the patient that really good option to shave down and not have any obvious signs of surgery. Another thing would be really the size of the punch used. Dr. Bisanga, we use a 0.75 to a 0.8, and even for the occipital, that's what we use as well. So you don't really need to use massively big punches that will then cause a lot more trauma to the skin. So even here you can see very fine, very small punches used, and that's really the Bisanga protocol that we've had at BHR. The area, the pattern, the size of the punch, it needs to be large enough to encapsulate the follicular unit with the protective tissue, and again, the smaller you go, the less damage to any peripheral areas and the better the healing. On top of that, you must look really at the depth and also the angles. Some FUE clinics, I can see it looks very raw after surgery. It looks very bloody, very raw. This is post-surgery, and you can see it looks really, really like it's just had a bee sting. So the actual depth in which we go is very important. 3-4 millimeters, depending on the attachment, on the type of punch used, but you don't really want to be going too deep that you're going to cause this unsightly kind of raw flesh look. So the size is important, but also the depth at which you will punch those grafts to make sure the patient heals really well. And you can see here again in the richer areas, everything that I've said before, the spreading, the extraction pattern, the depth is not too deep, and we can get those follicles intact. And also the angles, you want to try to make sure you do not elongate any of these puncture wounds, because if you elongate them, they're going to be longer. They're going to obviously have more impact on scarring and healing. So elongation and depth are very important in terms of not having a raw look and giving optimum healing to the patient. There are 5 things that we really look at, making sure we have that nice spread and not just obliterating one part of the donor. And if you do that, well, the outcome should be very favourable. Obviously placed in a different ball game, but if you can think of those 5 things and make sure your clinic takes into account those 5 aspects, then hopefully your donor will heal very well and you won't have any ongoing issues. Thank you so much for listening.